Welcome, everybody, to this great afternoon session in which we're going to talk about the recommendations of the Safe System Consortium. My name is Shannon Frateroli. I'm the director of the Johns Hopkins Center for Injury Research and Policy, and I'm pleased that you have chosen to spend your morning, afternoon, or evening, depending on where you're tuning in for, with us today. We're here today to talk about a report of the Safe Systems Consortium, and we have a great lineup of speakers to introduce you to the report, the recommendations, and the needed next steps to advance safety and equity in transportation in this country. There are many people who were involved in making this happen, so I urge you to take a look at the signatories on the report. There are people from different disciplines with different skill sets who all came together to put forth recommendations for how we can design roads so that safety and equity are prioritized. I want to acknowledge our partners in this effort, the Institute of Transportation Engineers, and also express my thanks to Dr. Jeff Michael, who holds our current Leon S. Robertson Faculty Development Chair in Injury Prevention. Jeff really took the idea for a Safe Systems Consortium and made it a reality. So thank you, Jeff. And now it is my great pleasure to introduce to you Congressman Anthony Brown, who is going to set the stage for our session here today. Congressman Brown represents Maryland's 4th District. It's a seat that he has held since 2017. In that capacity, he serves on the House Armed Services Committee and the Veterans Affairs Committee. Congressman Brown is a veteran himself, having been deployed to Iraq and served more than 25 years in the U.S. Army Reserve before retiring as a colonel. He's also a member of the Transportation and Infrastructure Committee in Congress, so he's very well positioned to really make use of the consortium report and recommendations. Prior to being elected to Congress, he was Lieutenant Governor Brown here in Maryland and a leader in the Maryland House of Delegates, where he served for several years. He's a graduate of Harvard College and Harvard Law School. And I'll end my remarks here by saying, Congressman, we're deeply appreciative for your service to our state and to our country, and grateful for your time here today. Thank you very much.
Well, thank you, Professor Frateroli. I want to thank you and Jeff Panayiotti, the Johns Hopkins Center for Injury Research and Policy, and the Institute of Transportation Engineers for hosting today's discussion. And Professor, thank you for that kind introduction. Also want to thank the panelists, the experts, the advocates joining us today as we discuss our transportation future and how best to ensure that safety and equity are the cornerstones of what we do in transportation infrastructure throughout our communities. We have an opportunity to fundamentally transform and reinvest in our infrastructure. Americans expect and demand safe streets as they go about their daily lives, safe for pedestrians in our communities, safe for bicyclists navigating our streets for recreation or for their daily commute, and safe for drivers. Yet each year, there are more than 40,000 traffic deaths in America. Many, perhaps all, but certainly the vast majority of these deaths are preventable, and traffic deaths are higher in underserved communities in our country. In Maryland, a plurality of the 2020 crash victims were Latino men, most of whom were middle-aged or seniors. Many of the victims of traffic deaths and injuries are Marylanders who take public transit, a population that is primarily persons of color, low income, and immigrant populations. These incidents don't need to happen. By dedicating ourselves to the safety of our communities and investing in local infrastructure, we can save lives. And thanks to the work of the Safe Systems Consortium, we have a framework to make our roads and neighborhoods safer. Over the past 20 years, a number of countries and cities around the world have adopted the Safe System approach, beginning with a commitment to eliminating traffic fatalities and serious injuries and focusing on survivability, shared responsibility, and designing safety into our road systems. We can't simply design roads to move cars faster, we also have to account for the safety of pedestrians, cyclists, and communities in our plans. People will make mistakes, but if we design our transportation systems with safety in mind, those mistakes don't have to be fatal. The Safe System model has shown success around the world, with countries like Australia, New Zealand, Spain, Sweden, and the Netherlands significantly reducing traffic fatalities. Now, core to the Safe Systems approach is an emphasis on equity. To eliminate traffic deaths and injury for everyone, we'll need to invest according to need. Underserved communities around our country, particularly communities of color, have been chronically underinvested in and deliberately harmed by exclusionary infrastructure and transportation policies. We have an opportunity to transform our infrastructure and invest in the transportation future of every community, with equity and justice at the forefront of our efforts. The fact of the matter is we have fallen behind in building the modern infrastructure that Americans deserve. Americans drive on crumbling roads and bridges and tunnels to get to work and get their kids to school. Communities lack transit options to get cars off the road and ease commute times. And too many towns and cities simply aren't built for growing pedestrian populations. What we need is a smart system of infrastructure equal to the needs of the 21st century, a system that encourages sustainable communities with easier access to our jobs, to our schools, and to our homes, a system that decreases travel time and increases mobility, a system that cuts congestion and ups productivity, and a system that recognizes and works to address the racial and ethnic disparities that have existed for far too long in our country. Furthermore, infrastructure is at the forefront of our recovery efforts coming out of this pandemic. The American Jobs Plan makes transformative investments in our communities that will create millions of good jobs, rebuild our country's infrastructure, and position the United States to remain competitive in the global economy. In addition to historic investments in our roadways, waterways, and airports, we'll prioritize the safety of Americans by finalizing minimum accessibility standards for pedestrians in the public right-of-way, directing the Department of Transportation to study how automated vehicles will safely interact with communities, particularly vulnerable road users such as cyclists and pedestrians. And we're going to strengthen safety considerations for our roads and bridges and revise roadway design standards to fully consider everyone who may use them. As we begin work on this package, I also introduced a bill called Safe Routes to School Expansion Act. In 2016, the CDC reported that 1 in 5 children killed in traffic crashes were pedestrians, and that's entirely unacceptable. My bill would expand funding for infrastructure improvements critical to child and student safety. We do so by expanding eligibility for projects such as sidewalks, crosswalks, signage, and bus stop shelters. And these improvements work. Safe routes to school infrastructure has been shown to reduce collisions for pedestrians of all ages by 75%. So as I wrap up my thoughts and observations, let me kind of restate the obvious. We're ready to deliver in Congress a comprehensive infrastructure bill, a bill that will create good union-paying jobs, expand the middle class, a package that will revitalize communities in every corner of the country so that no one is left behind or left out of the economic recovery, and fundamentally transform our infrastructure to be safer and more efficient. Rebuilding America for future generations shouldn't be a partisan issue. All of us, Democrats and Republicans, we use roads, sidewalks, and transit almost every day, as do our children and families. Envisioning a country where traffic deaths are a thing of the past is possible. So I look forward to working alongside each of you to make that a reality. So let me say thank you. And Jeff Aniati, back to you.
Thank you very much, Congressman Brown. We very much appreciate your service to our country. We appreciate the leadership that you're exhibiting in your role in Congress today. And for those remarks, I think you provided a great vision for us as we go forward and a foundation for understanding the opportunities we have both in the areas of safety and equity. So we appreciate your time with us today.
Thank you, and wish you the best in the rest of the forum discussion.
Thank you. I want to start by just thanking Shannon Frateroli and Jeff Michael from Johns Hopkins for their partnership in this effort. It's been a great experience for ITE to work collaboratively with the folks from Johns Hopkins and all the members of the consortium. For the last 3 years, ITE has worked through the Road to Zero Coalition and with support from the Federal Highway Administration in advancing and understanding and the application of the safe system approach in the United States. And we have a significant amount of resources available to us today. And I would encourage you to check them out at ite.org, our website, because I think they can help support the work of the coalition. I also want to recognize the leadership of members of my staff, Jeff Lindley and Sarah Abel, and the many volunteers that have contributed to the development of these resources, many of which have been involved in this consortium effort. The consortium report that you'll hear about today, it really takes us to the next level. It brings the safe system approach together with a better understanding and considerations of equity. And we have the opportunity through the work of the consortium to save lives by advancing the safe system approach, by creating a safety net for users on the system, for recognizing and by recognizing that people will make mistakes and that humans are frail. Today, we call on federal leadership, but I think it's imperative that we all embrace the mindset and the approach that is articulated in the report of the consortium. It is only through this approach that we will be able to move toward Vision Zero. Now, it is my pleasure to introduce our panel. Our moderator today will be Dr. Mark Rosekind. Mark is a distinguished policy scholar at the Johns Hopkins University and Chief Safety Innovation Officer at Zoox, the Silicon Valley firm designing and building an autonomous people mover. In prior roles, Dr. Rosekind was appointed twice by President Obama to serve in safety leadership roles as the 15th Administrator of the National Highway Traffic Safety Administration from 2014 to 2017, and as the 40th member of the National Transportation Safety Board from 2010 to 2014. Welcome, Mark. Joining Mark are our panelists, Meghan Mittman. Meghan is a regional principal in charge for Fear and Peers for San Francisco Bay Area offices and currently serves as the chair of the ITE Transportation Safety Council. Meghan works with clients at the local, state, and federal levels on multimodal safety policy, planning, and design, as well as culture shift and agency organization efforts to support Vision Zero via the safe system approach. Welcome, Meghan. Also with us is Dr. Jamila Porter. Jamila is the Director of Resilient Communities with the Big Cities Health Coalition. She leads the coalition efforts to build healthy, resilient, and vibrant communities with a focus on systemic equity, racial justice, violence prevention, and policy. Jamila has over 15 years of experience in public health research and practice. Her research covers public health capacity, policy evaluation, transportation equity, the social determinants of health, systems change, and healthy community design. Welcome, Jamila. And Robert Wunderlich. Robert is a senior research engineer and director of the Center for Transportation Safety at the Texas A&M Transportation Institute. In that role, he is responsible for leading the center's effort in traffic safety research, policy analysis, education, and outreach. Robert is a member of the Road to Zero Safe System Working Group and has extensive experience in municipal transportation operations and safety. Welcome, Robert. And Mark, it's all yours.
Thanks, Jeff. And a welcome not only to all of our participants out there, but also to our panelists. I'm looking forward to a lively and interesting discussion. So everyone, mic's on, and my role is really just to bring out the expertise that you folks have. All of you have been participants in actually generating this new report that's been out, but I want to make sure that those who are attending get a chance to really think more broadly, generally, about safe systems. I thought the Congressman just absolutely nailed it. Everyone thinks you can only have one or the other, safety or equity. They go together. How do we get there? And so a wide-ranging set of questions. What I'm hoping is that we'll get a chance to hear from each of you. And let's begin by starting with the basics. How would each of you define what is a safe system? Megan, why don't we start with you?
All right, thanks for the opportunity to be on this panel with you all. I'm so honored to be here today. When I think about defining a safe system, I've had the opportunity over the past couple of years to be doing this with Federal Highway as they take the leadership in this area. And so having conversations on what are the principles and the elements, but it's the tagline on all of their email signatures that's resonating with me the most. If vision zero is our goal, then safe system is how we're going to get there. And that just really gets to the heart of it. This is the implementation mechanism. It's also about humanizing safety. So getting back to the basics, these are not numbers, these are people when we think about safety. And people make mistakes. People are vulnerable. And so what do we need to do to understand the physics of how people get injured and to really zero in on what it is that causes people to get killed and severely injured on our roadways? What are the shared responsibilities that each of us has as a designer, as a road user, as someone who responds to crashes, to make sure we have redundancies in the system to really truly make it safe and work together? And a safe system is for everybody. And I completely agree that a safe system is an equitable system.
Thank you. Jamila?
Thank you so much. And thank you. Just a joy to be here with the panel. And thanks to the whole Johns Hopkins team and the consortium as a whole. It's a pleasure to be here. So for me, I define a safe system somewhat broadly. So I see a safe system as one in which every person has the freedom to move through public space. So that makes a safe system people-centered and justice-focused. It values all individuals and populations equally by ensuring that travel is possible for everyone of any age, race, ethnicity, income level, or ability. It also recognizes that past transportation system decisions have been harmful, and that the harmful consequences of those decisions persist to this day. And so these injustices have to be rectified through our current and future actions. And then finally, I would say a safe system provides long-term, sustainable, and equitable transportation access for generations to come by providing resources according to need based on those who need to use the system and those who have been marginalized and in a lot of ways prohibited from using the system.
Great. Robert, how do you define safe system?
Well, I think I look at it because I am an engineer, and as someone that's worked in agencies that have provided the system. And it's a change in focus from saying we're going to provide a system and we're going to hope that people use it correctly. We're going to try to train them and improve their behavior, and yet constantly be disappointed by the fact that they don't use it like we hope that they would. To a people-centric, where we're first going to look at the fact, and we're going to look at human capability to use it, and the consequences of them making mistakes. So we're going to focus on how people use it, and we're going to try to do two things. One, we're going to try to minimize the opportunities to make those mistakes. So we're going to try to make a simpler system, one that's easier and one that's more in keeping with the capabilities of humans to make less mistakes. And then when they do make a mistake, we want to have a system that makes the consequences, minimizes the consequences. So instead of, we know they're going to make mistakes, there may be crashes, but what we want is to reduce significantly and get to zero on serious injuries and death.
So let's go to all three of you again. Starting with you, Robert, what are the biggest benefits that you would identify that a safe system literally brings to roads and communities, as well as the biggest problems that could be generated?
Well, I think that there's the benefits are clear that if we minimize the number of errors, mistakes, and chances and opportunities to have conflict between different users, no matter whether they're drivers or they're pedestrians or bicyclists or transit users, if we minimize that, we're going to get a better operational system. It's going to run smoother. It's going to be better. And then if we minimize those consequences and the chance and opportunity for injury, that's just a huge benefit. Traffic safety is really a public health issue in most of our communities and throughout our states. And it's one that's not really getting better very fast. So those benefits are clear. I think the conflict is that that some of the things is we're going to have to limit some choices that people have. There's not complete freedom. There's not complete freedom to travel at whatever speed you perceive your risk to be. There's a consequence. We need to take into account the consequence on other users of the system. We may not be able to make a left turn everywhere we want. We may not be able to make a left turn by choice. We may have to have some restrictions. And I can tell you, as a former municipal traffic engineer, the challenge is people experience congestion or bad operations every day, and they don't experience even a near miss or a consequence or a bad crash, luckily, and so they tend to focus on that. And I think it's not only just the professionals, we've got to bring the public along so that they understand that we may be giving something up, but we're gaining a whole lot more.
Great. Megan, what do you think the biggest benefits are, as well as maybe some of the problems that might be introduced?
I think we have to acknowledge that we're stuck, and that if we keep doing things the way we've been doing them, that we're going to keep being stuck on our progress. And so the biggest benefit to me that I see in the pivot to safe system is some real progress and some actual, especially on the pedestrian safety front, turning the tide and getting us to the Vision Zero goal. And there's all kinds of co-benefits that'll go along with that fundamental safety benefit, like more sustainable transportation choices, obviously more equity for all road users and communities, and more livable and vibrant communities. But on the challenges or the potential things that we're going to face as we move toward safe system, the trade-offs that Robert was mentioning. So sometimes we're going to trade the number of seconds that somebody in a vehicle will be delayed at a traffic signal to give a more protected phase to a pedestrian or bicyclist, or we might take away some parking to be able to provide a protected bike lane on a facility. It's going to require a leap of faith in some cases. You have to build it so they will come. And sometimes we're going to be putting in facilities for bicyclists or pedestrians that aren't there because they don't feel safe being there right now. But if we build it, they will be there and they'll be able to have more choices. We're going to have to break down silos. When we think about the way Safe Systems is organized, it's deliberately not by different departments, it's by cross-functional teams. And so we're going to have to figure out how to collaborate and how to bring data together from each of those teams so that we can actually do a lot of the systemic work that's going to require that data. And if we really are going to be serious about equity, we're going to have to figure out how to engage communities in a way that we haven't done successfully in the past, speaking their languages, more authentically meeting people where they are, and really listening and letting communities define what success is rather than transportation professionals.
Thank you. Jamila?
I'll add on to that, and I really appreciate Megan's comments. I think one of the key benefits is that the central vision of Safe Systems is zero traffic deaths. And so that gets us into the heart of talking about disparities and what is perpetuating those disparities. And if we are serious about addressing them, then we have to do things differently. So I think if we are focused on zero traffic deaths as our goal, that will absolutely require a focus on equity, and it'll demand that we invest what it takes to achieve that outcome. And I think a shared and systematic approach to safety will ultimately reveal a variety of innovations and design and practice that will benefit our health goals and as well as transportation practice. And I think also, to give it a term, a lot of what I think I heard from Megan in particular too is around the curb cut effect. So this is an effect that's been used to describe how laws that were adopted to benefit a marginalized group often end up benefiting all of society. So that term comes from the disability rights community, where literally getting curb cuts into sidewalks benefited not just folks in wheelchairs, but also people pushing strollers, working with carts and loads, travelers with luggage that rolled. So I think thinking about it broadly and how when we make sure that those who are marginalized and disenfranchised in our society are benefited, it benefits us as a whole. And it's less about taking things away from people and more about really framing the benefits that we are all going to be able to contribute to. But on that note, I do think that one of the key challenges is that the Safe System approach was not originally designed with equity in mind. So because we are working in a US context, it will require that we address safety and equity within the Safe Systems approach in a way that's transformational, that we've just talked about breaking down silos, partnering across disciplines, and engaging communities honestly and authentically, and also using that information and that honest engagement to transform policies, fiscal structures, practices. I think it's easy to get caught up in the complexity and sort of the entrenched problems that we've had, and let's take that on and admit that we've not been operating from all of the best information, particularly when it comes from communities. And so utilize those lessons learned to transform our system in a lot of different ways.
So Jamila, great. We're going to go with the next question, starting with you, talking about those lessons learned. Can you give us some good examples of safe systems that have actually been applied in the United States, and give us some sense of what maybe the good and the bad results have been in those actual implementations?
I think that this is great. So I would say, and I would love for Robert, like from my experience, we've actually have more examples where we have had opportunities to do it and have not. I do think we have a lot of data across different localities and different environments where we really could be benefiting from a safe systems approach. We know the data incredibly well about how underserved communities that are sort of entrenched in low income and redlined areas are also experiencing a variety of traffic deaths. And so I think the fact that we know that provides a lot of opportunities to have good examples, as long as we're willing to take the time and make the investments to do it. So I sadly have more experience examples, say in DC, in Portland, like Atlanta, where I am, where we have policies on the books. We have sort of commitments and words about working toward Vision Zero, having complete streets policies, but we need more action and we need more investment, and we also need more cross collaboration and of course, community-driven engagement to get those things done.
Mm-hmm. Great. And I think she just handed it to you, Robert. Can you give us some examples and both good and bad results?
Well, I think the city of Austin here in Texas has really embraced both sort of a Vision Zero and a safe system approach to simplifying. They've done a lot of work to look at how they set speed limits and looking at more of a target speed. Speed is such a big factor in the consequences of crashes. It's probably the primary determinant of severity. And they've really looked at a different way and I think from a success standpoint, tried to find out how to make that fit within a framework that's not really friendly towards setting target speeds. In other words, we've for years let motorists make that determination. And I think there's a real change that we need to do with that. So I think Austin is a great example. New York City is clearly very putting in a lot of features that both look at speed, at channelizing, at simplifying intersections. I think some things that have been traditionally done are also that weren't really thought of as a safe system. So I'll talk about Carmel, Indiana, which ubiquitously uses the roundabout everywhere. And the roundabout is sort of the trifecta of safe systems. It's simpler, it has less conflict points, it reduces speeds, which is a severity thing, and it reduces the angle of impact in case someone does make a mistake. And the angle of impact for vehicle-vehicle crashes is another determinant of severity. So you've really got a city and a town that took years ago that step before. I don't even think the Swedes had thought of safe system at that time. But it turns out that some of the things that we do traditionally are a safe system. I think one of the things that we need to recognize is that a lot of the safety things that we've done in the past fit within a safe system. The safe system says more of an emphasis on it, and it says it needs to be for everybody, all users.
Meghan.
I've been thinking a lot about the difference between complete streets and safe system. And when we first, I think we're doing complete streets, I got to help start ITE's Complete Streets Council a while back. There was, does every mode have some type of zone on the street? Have we accommodated the bicyclist? Have we accommodated the pedestrian? And now that we're evolving on the safe system, and one of the the concepts that is really becoming apparent to me is the kinetic energy piece of this, right? So the speed and the angle. And when you understand that and understand we're really just trying to get at the severe injury and fatality aspect of it, then I think that's a more nuanced understanding of complete streets is helpful. So it's not just checking a box that every mode is accommodated, but are we really addressing the vulnerable road users and providing those protections? And so the cities that I think that are making the best advancements on the safe system side are the ones that have looked at those proven safety countermeasures that really get at that separating users in space and in time and reducing kinetic energy transfer. And I agree on the Carmel and also on New York City. You know, New York City has been doing leading pedestrian intervals and the hardened center line as systemic treatments. Of course, they've had no right on red for a long time, but those are just really great examples of those nuanced kinetic energy reduction treatments. I wanted to give a shout out to Fremont, California, who has measurable reductions as a result of their Vision Zero efforts over the last 5 years. And they've been institutionalizing their practices. Every time they repave a road, is there a chance to do a road diet? Is there a chance to do buffered bike lanes and protected intersections? Of course, on the speed side, what Portland and many other cities have been able to do to regain local control on speed limit setting and have those be contextually appropriate. And then finally, the San Francisco example of just breaking down silos and having the transportation staff really collaborating with the public health staff there on the data side to truly be able to get at systemic planning and a better understanding of exposure and risk. So yeah, just a few examples.
Great. Jamila, let's start with you on this one. You know, it's so clear from the discussion already that we just know that our current transportation system can divide communities. And so how can a safe system address the current inequities, including, you know, communities that have been historically underserved, but take us from the words to the actions? As you were just saying, you know, it's like, I call it hand waving. We can't just keep waving our hands about this stuff. So give us some examples of how do we get safety and equity, you know, and bring those literally to the streets.
Right, so I would say that first we need to make sure that we have a clear understanding of equity, especially in our current sort of national conversation around equity and around justice. We need to work from some clear terms. So I use Dr. Kamara Jones's definition of equity, where she says that it requires 3 things, which is valuing all individuals and populations equally, recognizing and rectifying historic injustices, and providing resources according to need. And so that's applicable whether we're talking about health equity, racial equity, economic equity, et cetera. And so again, if we're serious about getting to zero, which I do think is it's a very visionary and compelling goal, but it also requires us to start in our most under-resourced, marginalized, and historically disinvested communities. I think the safe systems approach that's implemented in places like that are where the investments will pay off most, that's aligned with sort of our egalitarian values around this. I think that another thing to consider is also that, you know, we are really working to try to undo decades of entrenched planning and policy decisions, which will be really complicated and complex. So we have to give this work, I think, a desire to see changes done already actually is unfair. So we need to give this work as much time and effort and intention as was given to put the harmful structures in place in the first, in the first place. So that requires us to, as we're doing, and as I do think that in hearing conversations around infrastructure, transportation and road infrastructure, expanding that, understanding that connects to safety in a broader sense, street safety in a broader sense, in terms of, for instance, in Ward 8 in DC, a couple of years ago, a resident was killed in a hit and run. And then the next day, 2 residents were lost to gun violence in the span of an hour. And so just to use that as an example, where in that same community, the residents paint their own crosswalks to understand like that the communities themselves are functioning with a different definition of what a safe street or a safe system is for them. And honestly, it's all interconnected, and we need to wrestle with that honestly and openly and transparently. Also using an example, Atlanta, as anyone who's ever driven here knows, there are traffic jams galore. And if you've ever asked why, it is one of the reasons is that when the interstate highway bill was passed, localities were given a lot of freedom about how they got to design them. And they were designed in many cities, not just Atlanta, to literally divide communities, white communities from Black communities. And so we need to acknowledge that that's happened. That happened with Interstate 20, for instance, that runs east to west in the city. And we need to first sort of wrestle with that, and then we can work from there about how to address it in a way that's meaningful and honest.
Meghan?
I think that the numbers and trends are so stark and obvious when you just map them out and start to overlay various different history trends and zones within a community. Working on Berkeley's Vision Zero work, we looked at their high injury network and overlaid the redlining map from real estate zones within their community. And it's so, coincident, one and the same really with the communities that were redlined and the communities where they're seeing just the concentrations of severe injuries and fatalities. And so calling it what it is, acknowledging the disproportionate impact, I think is the starting point to recognize the work that we need to be doing on this. And then engaging and collaborating with the communities that we have not been serving and collaborating with effectively. And one of the powerful ways that I've seen that being more successful is with community-based organizations, actually adding them to project teams and having the trusted voices in communities be those that are carrying the messages and providing the feedback and doing capacity building so that everybody can come together and have an equal seat at the table to be able to have conversations about how to define success and what tools are that will work for people's communities. And then finally, actually putting our money where our mouth is on this relative to prioritizing funding to address the inequities and the disproportionate impacts. And I want to give a shout out to Caltrans on an effort that they've been doing on this already. They have a systemic pedestrian safety monitoring program for each district. And recently we worked with them to reprioritize that list that they look at each year to have an equity prioritization variable in that. And so it's not just about the places that are the most risk on a collision and contextual basis, but those communities that need the investment the most as well.
Robert?
Well, I'm a data-driven safety analyst, and that's what I've advocated. And I think hearing both Jamila and Meghan, I think though the traditional sources of data that we've looked at crashes may not be enough. Meghan indicated the red lighting for being able to buy a house and that kind of thing. And you're lucky that this traffic engineer even knows what that means. So most of them are not. And so this is where we've got to collaborate across lines where, and data, we've certainly seen evidence about this overrepresentation of maybe lower incomes, people of color in that, but that's very difficult to get out of a crash report. And so we've got to combine health data, we've got to do injury data better, we've got to get hospital data in there, we've got to get this kind of, what are the circumstances, census data, the red lighting and that, and put them all together in order to really have a comprehensive picture. And it goes beyond traditional things that someone like I would probably look at. And what we've got to do is then we've got to go across to the health department, and we've got to get maybe even policing involved and to see if there's some relationships with that. So I think, to me, if we're really going to do this right, we've got to have a good data foundation in order to do it. And it's going to mean getting out of traditional silos or traditional evaluations.
So Robert, let's start with you on this one. What would drivers and other road users see in a safe system community? I mean, how would you experience driving, walking, bike riding in a different way if you were in a safe system community?
Well, I'm hoping you would see a system that's simpler to negotiate, that there are not multiple decisions that need to be made simultaneously, and lots of calculus about whether or not I'm yielding to someone coming the other direction if I'm a motorist, and I'm worried about either a pedestrian from you know, my left side or in front of me, and where are the bicycles? And maybe we've got a simpler, more structured system, I think is probably, to be honest with you, I think I'm going to be driving slower through that system. And the choice is, I'm going to get different visual cues about that. I'm going to get better information. There's going to be more of an emphasis on speed when we go through a system that's a safe system. I think as a non-motorized user, I'll probably have a higher level of comfort and that I am in a place where there's a sense of security. I think there's a sense of security that goes along with installing safe systems. Sometimes I'll have a separate place to be, and sometimes I'll have to share. I think there would be more awareness about sharing and how we do that. I mean, it's the kind of thing like everything we learned that we learned in kindergarten about sharing and taking care of one another. I mean, really, it's just a civility thing, and I'm hoping that there will be a sense of all of us in it together, using the system together in a way that doesn't impact another user negatively. And so I think we're going to give a little up in our freedom to do anything we want to, which is going to be one of the challenges in the United States. We're not Sweden and we're not Australia. And so we've got to figure out how we make that, how we couch that. We're going to need help. You know, when you're a traffic engineer, that's not your main expertise. So I think those things, we're going to see a system that's simpler and slower and has less consequences when something bad goes wrong.
Mm-hmm. Jamila?
So I would say, you know, we get the results that we design for. So I would say that drivers would need to see, again, I would say a well-connected system for everyone, not just for drivers. A system, I think that Robert hit on, that requires you to go slower, but by design, and that looks at not just one street, you know, one or two streets or cross sections, but zooms out and has looked at the entire corridor, the entire network, to make sure that the elements of the network that perpetuate high speed or that don't have sidewalks on both sides or don't allow for safe pedestrian crossings, those are the sorts of things that would be addressed in that sort of sample of a safe system or a community that has been developed or designed with safe systems approach in mind. The other thing I want to add is I do think it would also accommodate with equity. So equity meaning like those who are most at risk of death, right, or would be our folks outside of vehicles. So making sure that the system is actually designed to protect them most because they are most in need of protection.
Great. Megan?
I think one of the hallmarks of arriving in a safe system community would be hopefully that you see people walking and biking everywhere. And so that there's users of all modes, of all ages and abilities. You know, we think about the collision data as one of the key data sets we have for safety, but a really important surrogate safety measure is the feeling of stress and of near misses and of hazards. And if those are gone and that's the way we're defining success, then we should see people using all those different choices and modes. Obviously, slower speeds is going to be a huge component of this, and it's going to be required in order for those additional modes and users to feel comfortable and lower stress. And then I think we would just see a proliferation of those tools that I was mentioning before that we know are the safe system tools. We would see a community that has roundabouts, protected bikeways, protected intersections. The roads are 2 lanes or 3 lanes wide, not 4 lanes or 6 lanes or 8 lanes. And we have a lot of technology. I think there's a lot of promise on the vehicle side and on the infrastructure ITS side for technology. And we'd see communities really embracing the power of the technology piece of it as well.
Thank you.
And I just wanted to add too, I do also think in that community, we would also see design features that support those who are disabled. I think that as people talk about walking and biking, this is naturally left out of the conversation by the semantics we use. And it also changes sort of what the community requires to support those of all abilities. So I'll just throw that in there too, because I think that's also a consideration that will push us to innovate more than we have in the past.
Great. And you're not just throwing it in. That's got to be part of the core piece of the discussion, right? So we have about 10 minutes left. And you know, this event is intended to also highlight a new report that's come out So let's spend a little bit of time talking about the report, the recommendations, and what some of the expectations and potential actions are. So let's start with you, Megan, and just, why this consortium report now? What's the expected outcome from its release?
I don't think there could be a better time than to be talking about Safe System. I think it's kind of a trifecta of just a perfect storm coming together. We're hopefully emerging from a pandemic, and yet we're not, because we're still in the pandemic of transportation safety and injury associated with that. But we've all learned a whole lot of new, or I have a terminology and phrases around public health and understanding the importance of redundancy, of shared responsibility, and of vaccines. And I see the Safe System as the vaccine. And so the chances to double down on a lot of the phrases and terms and public health messages is a key reason why now's the time for a Safe System. We have new administration and opportunity for legislation. And so leadership is clearly required if we're going to pivot, if we're going to fundamentally reframe the way we're thinking about safety. And I think that the stars have aligned for that. I'm hopeful and would just be really heartened to see the report from this consortium taken to that next step by our federal leadership. And the time is now because it's worsening, right? The crisis is only getting worse, especially for pedestrian safety, especially for disproportionate impacts to many communities. And so it's the urgency of it is very much there. And so the timing for our ability to get out ahead of that and to meet the moment is now.
Robert?
Well, I think there's two things. I think someone mentioned earlier that, what we're doing isn't working. And there's a lot of good evidence that this approach is an effective approach. And I think Megan also alluded to it in that we're coming off, during COVID, we had the exact opposite of what we want to see in a safe system environment. In a safe system environment, we want a reduction in risk for fatality and serious injury, and we're not so concerned about crashes. What we saw from our analysis of the data during COVID is crashes went down considerably and fatalities did. In fact, fatalities in Texas were higher in 2020 than they were in 2019. And the proportion of any given crash of any kind that was fatal went up some 12% over the year. And during the three quarters of COVID went up 30%. We went in exactly the wrong direction. And we're seeing a continuation, even though traffic volumes have gone up, the activity, the fatalities are still exceeding. So the risk is still up. This is the time. The time is now for this approach. And it's essential that we change the trajectory. And this is particularly true, as Megan said, in pedestrians. We saw no decrease. And in fact, there may be some evidence that, people, that was one of the COVID coping mechanisms, was to get out and walk. And we know it's an urban problem. We know it's at night. It's time to do something about it. And the time is now. We can't wait any longer because the situation exactly is not going in the direction that we need it to go.
Jamila?
I would agree completely. I definitely think it's an ideal time. Everything that my colleagues here just said, I only would add is that, there's been national conversation finally around infrastructure and how broad we need to make that word. And so we need to just not include physical infrastructure, but policy, people, systems, processes. So I think not only is the problem getting worse, but we actually are now poised to have a stronger and broader understanding of what we need to do. So, shame on us if we don't take the steps now and work, across disciplines and across communities to really address this and really make some impact quickly.
So before we get to our last question, quick lightning round. I'm curious if each of you would highlight what you think is like, what's the one recommendation that you get to talk about right now before we get to the last question? So think about the report, and if you've got one you want to highlight, we'll do Robert and then Megan and Jamila. What's the one you'd like to highlight? And then we'll get to the last question.
Mark, I think that the one single thing I would say is that we have got to rethink the way that we set and establish speed limits in this country. And we've got to take away the any of the legal structures and laws that keep us from taking into consideration the consequences on all users. I think it's an impediment. I think it's not just a philosophical problem, although it is first a philosophical problem, but it's also a legal problem where I've got colleagues that are saying, yeah, I'd like to set target speeds, but I don't see how I do that in compliance with the rules and regulations that professional engineers are under. And that's an impediment that we've just got to stop. That's a policy thing that needs to happen. And that would be my one big thing that I would say, because if you can change speeds, you can touch more of the infrastructure. The problem with, you know, trying to do something physical or even operational is there's just so much system out there, and it's very hard to touch all of it. But an easy way, a more direct way, is through being able to set long stretches of speed limit, and we've got to rethink the way we do that.
Great.
I think the real opportunity of the moment right now is around funding and getting our funding priorities to be fully aligned with a safe system commitment. And so having new federal programs, having prioritization requirements, that anything that's receiving federal funding needs to have a safe system lens. Not that there's a separate safe system bucket of funds and programs, but that everything going forward will be safe system to be able to be eligible for federal funding. I think would be the most direct way to change our commitment from reducing vehicle delay and improving level of service as our primary goal to a safe system for all road users as our primary goal.
Yeah, I would agree. I think that the funding is really the unique opportunity, I think, but also connecting federal funding to equity very explicitly with words written, you know, in plain language in black and white. So I think that's the place where I think the recommendations are more forward thinking than perhaps ever before in the past.
So we have literally just a few minutes, like 3-4 minutes left. And there have been some great questions in the chat, and we're not going to get to those, but hopefully there'll be another opportunity for people to hear what you have to think about those. But for the last question, this has been a great discussion, but literally tomorrow, if there was an action that could be taken that would make a difference, right, to advance safe systems in the US, what would that action be? Because some of the things you're talking about, the speed issues, the funding, these are a little bit more, even though they're near term, takes a little bit longer to get at them. If we want to start progress tomorrow, what would that action be? Megan, why don't we start with you? And then Robert and Jamila, we'll let you wrap it up.
I had come down to speed as my answer on this, reading the NTSB report, the RAND report, California's Zero Fatalities Task Force report. It all zeroes in on speed, and it's changing the 85th percentile so that we can have local control to set our speed limits using speed safety cameras. And so maybe that's something that's, you know, even quicker. Usually it's just legislation has to be changed in some contexts, and then really designing for target speeds. I think Jamila just made it the point so clear. We get what we design for. We get what our intended, what we measure as success is what we're going to get. So what are we going to define as success so we can measure success and get that outcome?
Great. Robert?
Well, I will say that I think I would ask everyone when they wake up tomorrow to stop thinking about what somebody else can do to improve safety and start thinking about what they can do. What do they have under their power? What could they do today? What decision can they make? What research can they do? What reporter can they talk to? What kind of advocacy they can do? And what can they do in their job under the things that are under their control to implement a safe system? Don't worry about anybody else or changing the law or anything. It's what you already have under your control. That's what I would ask for.
Great. Jamila?
For me, it would be having transportation agencies take on health and equity as their charge. Robert earlier said that transportation is a public health issue, which we've said for a long time. I would flip that and say that public health is a transportation issue. So I think being able to understand that their goals, transportation goals, are tied to health and equity goals. Like we And I think being able to have that narrative be more clear, show the interconnections more clearly, I think this is work that can be done today. And to seek out, if we agree and believe that public health is a transportation issue, to encourage our transportation colleagues to seek out those relationships and partnerships so that we can work collaboratively to achieve mutual goals.
So the three of you have just been wonderful. I told you you'd be stars. You're absolutely rock stars. This panel was great, very thoughtful, articulate, timely. And I can't think of a better way for this report to see the light of day, but except through the three of you helping to communicate that to everybody. Great thanks. We'll hand it off to Shannon, but I just can't tell you how wonderful I think all three of you did, really bringing to the world this new report. And then all of us, we want to go from that hand waving to the actions. So thank you. Shannon.
Thank you, Mark. Yes, thank you, Mark. And Meghan, Jamila, Robert, thank you so much for being here. I agree wholeheartedly that you have been great ambassadors for the power of our report and recommendations, and I'm so grateful for your time and commitment throughout this process. Jeff Paniati, would you like to say a few words to wrap up at this point, and then we can talk about some next steps?
Sure. Thank you, Shannon, and thanks to our panel. I think they did a fabulous job. I think the Congressman, sort of laid the foundation, and then the panel, I think, really built off of that in their conversation. I guess I would just highlight, a few takeaways, for me listening to the panel and thinking about the report. We want a people-centric and community-centric approach, right? We want to focus on speed and kinetic energy as difference makers. We have evidence that the safe system approach can work based on the work in other countries, but we have to bring that into a US context. And the opportunity, I think, for us is bringing together the questions of safety and opportunities in the area of safety with the questions and opportunities in the area of equity right now, bringing those two. And the report, I think, that the consortium did really lays out how we can take on those questions of safety and equity using a safe system approach in the US, and identifies critical pathways to do so. We call for federal leadership, but I think the closing remarks from the panel were just right. We need federal leadership, but just as Robert said, we need every person to wake up every day and think about what can they do, what's under your control, where you can begin to implement the safe system approach, today and tomorrow. So I thought, that was just great conversation, and really brought out a lot of the elements that were talked about by members of the consortium as they put the report together and formed the recommendations.
Terrific. And Mark Rosekind, expert job of managing that conversation. Thank you so much for participating in this event as well. When I think about sort of what we can do, what you can do to move this issue forward based on the wonderful dialogue that you've heard here today, there's three easy things that kind of come to mind for me. First of all, I challenge you all to download and read the report that we've all been referencing. Check out those recommendations, and then discuss those recommendations with people in your networks, and identify ways that you all can advance a safe system approach and advance those recommendations that are laid out by the consortium in our report. And then finally, I'd say contact us if there are ways that we can help you support dissemination and the report and recommendations. So there's lots to be done to realize the vision that you've heard about today. We've got a roadmap, pun intended, in the consortium's report and recommendations for you. Please take that report and do good in your communities with those recommendations. And with that, I think we can close out our time here together. And thank you again for being with us this afternoon.
Thank you, Shannon.